All right, do you have back pain? Well, we're going to find out if extension exercises or extension stretches help you.
So, Bob, flexion,
Right,
extension, just so we're all on the same
right.
page.
Check it out.
Bob and Brad, the two most famous physical therapists on the internet.
All right, if you're a flexor, that's someone who, whenever they bend forward, it actually hurts. Like when they sit a lot
Yep.
or when they reach down the floor. I mean, that kind of person, this exercise may help them.
Right.
All right, we're going to show you the whole progression for extension exercise. We're first going to start with a couple pillows underneath your pelvis. If it hurts when you lie down flat without pillows, start with pillows.
That's right.
Now, this may be for a couple minutes. It might be for the whole first session. Just lie there. And if it feels okay, get rid of one of the pillows.
So we'll pull one out. I've had people where 2 minutes and I get to pull one out because
Sure.
they're settling down.
And then eventually the goal is to get rid of the pillow.
Flat on the plinth of the.
All right, now
floor.
we're just lying flat. We're seeing how you tolerate that.
Right.
It should feel better. And then eventually you could even try putting a fist underneath your chin. This,
Go like this.
yep, this is a McGill, Dr. McGill technique.
So really what's going on is help elevating the shoulders, which helps to extend the back slightly.
Right, and then we go to two fists.
A little bit higher here, a little more extension.
All right, then we go to prone prop.
That's right. Oh, I can do this from behind. Then I don't have to step in front. Look
There
at
we
that.
go.
We got the arch in the back. This is the opposite of flexion, so we're extending. That's the
Again, you
title.
might try a few seconds and see how it does.
Sure.
Work your way that way. And then eventually, Brad, what you're going to do is actually do micro push-ups. So you put your hands underneath the shoulders and you go, it's a little mini press-up.
And observe, Bob's waist and pelvis is not moving. Everything is happening in the low back.
Right.
and
It's
upper
not
back.
lifting up like this.
Exactly.
This should feel better.
Right.
If it's worse, you're not going to do this. All right? Then eventually, Brad, what you can try to do is work towards doing full extension.
Right. I've had patients come in where I started with 2 pillows, and within the time they left, within 45 minutes, they were to this level. Not always. This might take a few days.
Now, again, you can do this every hour, like throughout the day, as a way of treatment. If it feels good, you keep doing it.
Right. You may need to lay down for a minute or two before you start those. Is very common, and then
Right.
work on the extensions. Usually 10 is the most you'll do. Unrest, maybe another set
All
of
right,
10.
let's say you get stuck, Brad. You're going like this, but you really are lifting up your pelvis because you're
Yep.
so tight.
Yep.
What you might try is a strap.
Well, yeah, what you can use
Oh, yeah.
a button strap, or you just take a sheet and roll it up, or something that you can go across the back, the low back.
You grab on with your hands, and you go up like this, and you work in different spots.
So that supports that lumbar spine and accentuates the extension. That's a nice one.
Now,
to
if you
put.
have a friend, and I don't, but if Brad would
I'll
help me
help
out,
then.
you could actually push down on my back while I'm doing this.
Yeah. And this is something that you may want to wait and have a therapist do, but it's just gentle pressure, and the only reason Bob's going to do it if it feels good.
Right.
If it hurts, back off.
Do you want to show the stretch out strap?
Yeah, here we go. It's got loops every 6 inches, and that comes in very handy. So you can just stick your hands in there, and you don't have to grab a hold like you do the sheet.
Right.
It just grips right in naturally.
And then you can use it for stretches to the legs.
Yeah, you use it for a lot of different things,
Yeah.
actually. They're a nice.
All right, that is the entire progression, Brad.
That's right.
And again, you're not going to do it unless it what?
Feels better.
Right.
Clearly feels better when you're doing it and afterwards.
There we go.
Wow, Bob, I feel a lot better now that I've watched you stretch your back. My back feels better. What are you pointing at him for?
All
Oh, yeah,
right.
I'm looking at the
So
wrong
long,
camera.
sayonara.
This takes a while to get used to.